Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with Mr. James, a physiotherapy technician, discussing techniques for treating patients with herniated discs. You now have 90 seconds to read questions 31 to 36.
Good afternoon, Mr. James. Thank you for speaking with us today. Can you explain the physiotherapy techniques used to treat patients with herniated discs?
Good afternoon. Certainly. For patients with herniated discs, we often use a combination of exercises, manual therapy, and sometimes traction. The goal is to reduce pain and improve mobility.
What kind of exercises do you typically recommend?
We focus on strengthening the core muscles, which support the spine. Stretching exercises are also important to relieve pressure on the nerves.
You mentioned manual therapy. Can you explain how it helps?
Manual therapy involves hands-on techniques, such as massage and spinal manipulation, to improve movement and reduce pain. It's particularly effective in easing muscle tension around the affected area.
How does traction work in treating herniated discs?
Traction gently stretches the spine, which can help relieve pressure on the herniated disc and the affected nerves. It's a non-invasive method and can be very effective for some patients.
Are there any precautions patients should take when undergoing physiotherapy for herniated discs?
Yes, it's important for patients to avoid activities that can strain their back, like heavy lifting or sudden twisting movements. They should also follow their therapist's instructions carefully to avoid aggravating the condition.
Thank you, Mr. James. That was very informative.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a presentation by Dr. Lisa, an orthopedic surgeon, discussing herniated discs and treatment options. You now have 90 seconds to read questions 37 to 42.
Good morning, everyone. Today, I'll be discussing herniated discs, a common condition that affects the spine. Herniated discs occur when the soft center of a spinal disc pushes through a crack in the tougher exterior.
What are the common symptoms of a herniated disc?
The most common symptoms include pain in the back or neck, numbness, tingling, and weakness in the arms or legs. The symptoms depend on the location of the herniation.
What are the primary causes of herniated discs?
Herniated discs can be caused by age-related wear and tear, sudden injury, or heavy lifting. In some cases, genetic factors might make someone more susceptible to developing this condition.
How are herniated discs typically diagnosed?
Diagnosis usually involves a physical examination and imaging tests, such as MRI or CT scans. These help to determine the extent and location of the herniation.
What are the treatment options for herniated discs?
Treatment can range from conservative methods like physiotherapy and medication to more invasive procedures like injections or surgery. The choice of treatment depends on the severity of the symptoms and the patient's overall health.
What advice would you give to patients to prevent herniated discs?
Maintaining a healthy weight, Practicing good posture and avoiding heavy lifting can help prevent herniated discs. Regular exercise to strengthen the muscles supporting the spine is also crucial.
That is the end of Part C.
AVN Pharma Education.